about the assignments in Pearson. And as I mentioned before, I guess not to everybody, if I did not cover something in the class and the assignment is coming up to due date, don't panic. So I will postpone the due date, so you're not going to be, punished because we didn't get there yet, so don't panic. I had the intention of going faster with the class than I did last semester, but it's kind of like not really that much possible. So I don't want to be rushing through this stuff. So, we cover what we have to cover, and that's pretty much it, Okay, so here, continuing and finishing up with the integument, where we left off before, right? We're talking about some conditions related to hair, right? So we're going to finish up with the hair and with the skin. Also the nails, right? So here, just to brush through some of the issues that we can have with hair. Remember, hair is coming out of rapidly dividing cells that eventually die and get deposited. Just because, remember, hair is derived from the epithelium, mainly, right? So you get those rapidly dividing cells that are getting deposited here. The cells are dying. The hair is being pushed through the shaft here, getting to out of the skin of the scalp, and that means those rapidly dividing cells can malfunction depending on several things. One thing is that stress, high levels of stress, can put the hair mainly to sleep. We didn't cover cycles of hair growth, but mainly you have like active growth, and you have a dormant cycle in which the hair falls off, and then the root here this stays asleep for some time, and then the hair wakes up again. Sometimes it takes about 6 months for this hair follicle to undergo this cycle, right? But then if your hair follicle is alive, it will come back to life and your hair starts growing again. High levels of stress can put a lot more of your hair follicles to sleep. So it's not your impression, in case you are under a lot of stress, when you shower and then you brush your hair, it's like, oh my goodness, a lot of hair is falling out, I'm losing my hair. Yeah, stress can make you lose your hair, okay? And you call that telogen effluvium, or TE, so the spinning of the hair. So the hair comes out, you can fall, you can lose some hair, okay? So stress can cause that. What kind of stress? Every type of stress, okay? You can have surgery or stress from surgery, emotional trauma, or maybe you're trying to lose some weight really quickly, because some people, sometimes you have like graduation to go to, or somebody's wedding to go to, and you want to fit into those clothes, so you go through some crash dieting, and then you realize that your hair starts to fall out. Yeah, crash dieting can definitely make your hair fall out. Not only crash dieting, but also protein deficient diet, okay? And with saying that, if you have patients who are morbidly obese and they undergo bariatric surgery, that can also be a cause for hair loss. And now you have a double whammy, because you have a very intense diet and you have stress from surgery, so you lose a lot more hair anyway. So you can definitely lose hair, and also bariatric surgery and protein deficient diets can make you lose hair. Now you should think, why is it that dieting is going to make you lose hair? Well, it depends on how much weight you're losing and how quickly you're losing the weight. A lot of times your body goes into this starvation mode, right? Sometimes you start to lose weight and you lose very quickly, and then you hit a plateau, and it seems like no matter what you do, the weight doesn't come off, So that's when your body starts to slow down your metabolism, and it goes into this starvation mode. And the body is really smart. Sometimes. Why does the body do that? Well, if you look at prehistoric times when food was not available all the time, So those humans who would go into this starvation mode would survive a period of famine and then, get to, procreate and live to see, other times, right? Nowadays, situation is different, right? So the body did not adapt to the supermarket, for example, right? You cannot just tell the body, like, look, there is food, do not go into a starvation mode. It's like, okay, it doesn't work, right? So the body decides to save energy whenever it's possible. Things that are not absolutely necessary to spend energy on, it will save the energy. Like, for example, growing your hair is not a life-saving strategy. I mean, at least the body thinks it's not, right? So you're going to lose hair, okay? So that's what happens with dieting and losing the hair, and then stress. Also, the body thinks you're dying, so it starts to save energy by losing the hair. Who figures out what the hair does? So that's one reason why you can lose a lot of hair. Is it normal to lose hair every day? Yeah, you can lose about 100 hairs a day, And I actually had some friends who thought that they were losing way too many hair, too much hair at once. So, this girl actually counted the hairs that she was losing in the showers, like one by one. What? But she had already, not a lot of hair to begin with. But anyway, so yeah, you can lose hair. It will grow back eventually. Some drugs can cause you to lose hair, especially drugs that will interfere with cells that are dividing, like chemotherapeutic drugs. Like old generation chemotherapeutic drugs, like first generation type of chemotherapeutic drugs, because those drugs interfere with the DNA during cell division. So you have some intercalating drugs that will halt DNA synthesis when the cell is undergoing division. Okay, we know that cancer cells are rapidly dividing cells. So if you can kill the cells that are rapidly dividing, then you might kill the cancer before the drug kills the person that is with the cancer. Yeah. So those drugs are kind of harsh, and they will affect all dividing cells, including your hair, including your skin, and including your endothelium, meaning the lining of the GI tract, right? Stomach, intestine, those are rapidly dividing cells, especially small intestine, right? So chemotherapeutic drugs really, really affect those dividing cells. Can you think of other types of dividing cells that can be affected by chemotherapeutic drugs? Let's say you have a pregnant woman, right? A pregnant person, and you have that fetus that is dividing cells very quickly because the fetus is growing, right? So chemotherapeutic drugs are going to, stop those cells from dividing. It's going to stop pregnancy. Okay, so those are also abortive type of drugs. Right? All right, so chemotherapeutic drugs. Some antidepressants can also, make you lose your hair. But then you think, well, if the person is taking antidepressants, the person is already under stress. So is it like the stress or the drug or combination, addition? It can, anything you think of that can be stressful is going to make you lose hair. Okay. Problem with your thyroid gland, especially hypothyroidism, slowing down of the thyroid gland, that can also make you lose hair. All right, so here was with the hair, and then we get to the nails. So some fun things about the nails, right? It is also a modification of your epidermis, and you also have keratinized cells, but in this case you have very hard keratin. And of course it is different than the keratin that you find on your skin and on your hair, but they come from the same type of tissue. What is the use of nails? Well, it's mainly to protect the tip of your fingers and your toes, right? And it's to protect the tip of the bone of the fingers and toes, okay? Things that you should know about the nail. You have the free edge, that's the part that you clip, right? You have the plate that is over here, so that's the clear part that is not on the tip. Okay, so that's the plate of the nail. And then you have the root, which is under the skin, like where it's here. Okay, after the root, or before the root, depends on how you look at it, you're going to have the hair, the nail matrix. So here is where you have your cells dividing, and they are actively pushing this dead keratinized cells to the rest of the plate, of the bed plate, bed nail plate. Okay. So what is important to know here? Cool things about the nail, right? So you have to know where is the bed, where is the matrix of dividing cells. You have this area here that is called lunule because it looks like a little moon. Okay, so this is with the part that you see your cells that are dividing, and here's where they start to lose the organelles and the nuclei, and then they get deposited in this session. What is also interesting to see here, okay, so you have this area here that is live skin here that you call the eponychium, right there. Some texts say that is the same as the cuticle, but there is a little bit of difference. So the eponychium is the live part that has the blood vessels, and then the cuticle is the dead skin that comes right after the eponychium. Well, yeah, it's about the same thing. You clip the cuticle, if you clip the eponychium, you're gonna bleed, okay? So that's the eponychium. On the side, you have another name for it, but yeah, don't worry about that. So it's eponychium. Another cool place here is this part that is connecting the nail plate with the skin under it. This is a hyponychium right there. So this is the part where you can accumulate the dirt, right under your nails. I think those two names sound more like Harry Potter spells. Eponychium, hyponychium. So yeah, you get the picture. All right. What else is interesting here about the nails? I guess this is pretty much it. Oh yeah, the stuff that you can see by looking at nails. Right? So just like looking at the skin, you can say if the person is at a certain health state or disease state, right? Remember, if you have somebody who's looking pale or blue or yellow, right? You can see, you can deduce some underlying causes of why the skin is looking like that. And then when you look at the nails, you can also say some other things. For example, if you look at a person's nail and the nail looks like this spoon-shaped nail, you call that koilonychia. Okay, another Harry Potter spell, right? So a spoon-shaped like this, okay, that is telling you something about a dietary deficiency of this person. So it's usually due to iron deficiency. So spoon-shaped nail, iron deficiency. Also, flaky nails, weak nails, that is also a telltale sign of iron deficiency. Okay, so spoon-shaped nails. You can say the person probably have to take iron supplements or supplement in some form. Okay. If you look and you see yellow type of nail, you might have some type of thyroid problem or respiratory problem. Okay. And if you see thickened or whitish, yellowish, whitish nails, that can be fungal infections. We usually see that with the toenails, right? And especially if you go to gym and use a shower, sometimes you get this fungi that will come from other people. So it's always a good idea to use some slippers when you shower at the gym, something like that. So toenails, they're actually very difficult to treat because it goes under the nail and then it gets housed and protected over there. It's kind of very difficult to treat fungal toenails, okay? Infections of nails. All right. Another thing here, blue lines. Blue lines, so those are like beauty lines, but they're really like horizontal little lines that show up like this on the nails, and they can indicate uncontrolled diabetes or uncontrolled high blood sugar. Okay. Besides that, they can also indicate some kind of heart problem. Okay. Usually when you have these whitish little lines, they can indicate a blood sugar issue. but then when you have little dots or pigmented, look like little blood vessels that broke under the nail, that is more of an indication of heart condition. Okay, it could be a serious type of heart condition. Okay. On the other hand, you can also have these blue lines that can show up because of some types of drug treatment, especially chemotherapy. Okay. So this is the time when I look around and I see people looking at their nails like, oh my God, what is wrong with me? Something wrong with my nails. But then on the other hand, you have situations in which the person is actually anemic and iron deficient. And another sign of being anemic or iron deficient is that you don't remember things very well. You can't recall stuff. You can't reason things very well. So the person who is iron deficient might even notice that the nails are breaking and you kind of have a little bit of a spoon nail, but then the person can't really think what's the reason. They won't even think about it because that's the other sign, right? Yeah, it kind of happens. So I would say, if you have a roommate or a friend close by and you're looking at your nails, no, look at their nails and say like, oh, let me see your nails. It's always easier to identify the problem of somebody else, right? Especially if you're going to go into a health field and you're going to see patients. Look at the nails, look at the skin, see if it's telling you something about the health state, right? Okay. And then we get your fun glands, sweat glands. Those are sudoriferous glands. Okay, so finishing the nail. Any problem? Any questions with the nails? Any comments? No. All right, cool. All right, so let's get to the glands. So here we have sweat glands. So those are sudoriferous glands. You have them basically everywhere except in a very few places. Like you're not going to find sudoriferous glands on the nipples and in parts of external genitalia. Okay, those parts, no sudoriferous glands. All right, how many glands do you have? A lot, like 3 million around, like all over your body. Okay, what kinds of glands they are? We have mainly two types of merocrine glands. One of them you call eccrine glands and the other one apocrine glands, although it is really a merocrine gland, but you call it apocrine gland. All right, so those two are sweat glands, and there are some differences between one and the other. Okay, how do they work? They are connected to the nervous system, and they are going to respond to either some nervous situation or to regulate your body heat. All right, so here's the first kind. You have your eccrine gland. So that's your regular sweat gland. And how you're going to identify it? It is a gland that secretes clear fluid straight into a little pore on the skin. So it can be close to a hair follicle, to a hair shaft, okay? But the gland itself is like right on the skin. It has its own little pore, and you can see it when you sweat, okay? So the ducts of the gland, they are going to open straight to the skin, to the pores on the skin, okay? Main function of these glands is to control your body temperature, and they're going to work based on your sympathetic nervous system. Okay, sympathetic is your fight or flight type of nervous system, right? Once the gland gets activated, what's going to come out of it? Mainly water. 99% is going to be water. Then you're going to have some salts too, right? So if you sweat a lot, you might notice that sweat is kind of salty, okay? Other things are going to come out, but it's in very, very small percentage, like a bit of vitamin C, some microbe killing type of proteins, right, peptides, some metabolic waste, but very, very small amounts. Mainly you're going to sweat water and salt. Okay, so here comes your first question. Okay, the most important role of the eccrine sweat gland is to do what? Okay, you got about 5 seconds. What is your answer? C. Some people answered stress-induced sweating. No, that's not the primary, most important role of sweat glands. Okay. Okay. Then you come with these guys here, apocrine sweat glands. How are you going to distinguish this from the eccrine ones? These guys here are going to sweat into a hair follicle. I mean, the hair, duct. It doesn't have its own duct that it goes out in a pore in the skin. It goes into the hair duct. Okay. Now, what this thing secretes is not clear, is not water like the other gland. It secretes this type of milky or yellowish kind of viscous fluid, okay? And this thing doesn't really have a smell, right? But it happens that you have a lot of bacteria that sit around the hair over here, and the bacteria like to break down this secretion, and the bacteria will produce the bad smell, okay? Now, where is it that you're going to find those glands? Armpits and on the genital areas, okay? So armpits, you got your sweat glands. When do they start to get activated? Around puberty, okay? So with little kids, they don't really have a bad armpit smell. But then once they hit puberty, no, especially the boys. Oh man, I got 2 boys. They hit puberty and that room was like, oh man. So those glands definitely got activated, And this is when you have to remind them to, take a shower. I don't know with the boys. And I'm sure all the boys here like to take showers. But my boys, oh my God. The youngest one, oh my God. Okay, now he's better. He just hit his 20s, so now he likes to take showers. So it gets better. There is hope. Okay. All right, so those glands start to get activated around puberty. Okay. Some modifications of these types of glands. You have ceruminous glands, so those are the ones that will produce the ear wax, okay? And then you have other modification of these glands. Those are the mammary glands. Yeah, isn't that weird to think that you're going to produce milk from a gland that can also produce this kind of sweat? I mean, not the same thing. It's a modification of that type of gland. But yeah, there's a modification of this apocrine gland. Now, how is it that you're going to produce here the secretions? Oh, same thing with the merocrine gland. They're not like dying and exploding. Okay, that's the next gland. Okay, this is the one, sebaceous gland. So these guys are oily type of glands. They are also stuck to the hair. Okay, stuck to the hair duct right here, just like your other apocrine gland. Okay. And these guys are going to secrete kind of oily substance that is actually good for the hair. You get like shiny hair, manageable hair. It's because of those glands. So they're going to secrete into the hair follicles, okay? And they are also quiet until puberty. So everything goes activated during puberty, right? So what happens here? Those glands, those sebaceous glands, those are the types they have the type of cells that will explode and die. So those are your holocrine type of cells. Okay, so they explode, they die, they put this oily substance that is going to, shine your hair. But then sometimes they create trouble. Sometimes you can get a clog in this hair pore in the follicle. Okay, you get some bacteria that gets stuck in there, and then remember the bacteria like to eat up the stuff that those glands are producing, and the bacteria is going to grow, and then you're going to have a little infection that is going to happen here close to the hair follicle. And what do you call that? Acne. Yeah, pimple, acne. They're pain in the neck. And then what do you do? Block it out, try to get the thing cleared, put a little sometimes a little antibiotic, but I would advise not to use a lot of antibiotic on your skin because it's, whatever is there is part of a microbiome. Try to use natural things that will try to clear up your pores. Okay, round emphasis things. So here you're going to have your eccrine gland, and those are your apocrine glands, and here your sebaceous glands. So you got to identify them, know where they are, and what they're producing, and what's their main role. What is the purpose for those glands? Here about your whiteheads and your blackheads and your acne. Okay. All right. So functions of the skin. Things that should be quite obvious is protection, regulation of body temperature. Okay, that's a big one. Okay. It is a sensory organ, so cutaneous sensations. Okay. It is also very useful for production of vitamin D, right? And one thing that you never think about, it is a reservoir for blood. The skin can hold a lot of blood in case you need to mobilize this blood in case of stressful situations. What is the first thing that your skin does? It will contract the arteries, contract the blood vessels, and push the blood to the inside of the body. This is why when you are, afraid or getting ready to run away from, I don't know, a tiger, a dog, or some strange situation, you look pale because the blood gets drained out of your skin. Okay. On the other hand, sometimes you can have allergic reactions in which the blood vessels can dilate way too much. That's when you can go into shock and die. Okay? So that would be a type of shock that is related to hypersensitivity reaction that can cause death. It's quite scary. And here is a minor function that is excretion of waste, but this is why is not really red and bold and highlighted. So very, very minor function for excretion of wastes. Okay. So most important function here, or also very, very important function besides protection, is really temperature regulation. So you sweat a lot every day. Even if you don't think you are sweating, you are sweating. Okay. How much do you sweat? Look at this. 500 milliliters a day on an average. And we're not even talking about the hot days. Okay. This is like 2 large glasses of water you're sweating without even thinking about it. And what you call this type of sweating? You call insensible, because you're not thinking about it. You're not feeling it. Insensible type of sweating. Okay? It happens to everybody. Everybody sweats. Okay? And then you have the other type of sweating. That is the sensible type of sweating. This is the type of sweating that you can actually feel it, right? So you go out for a jog and you start sweating. That is sensible sweating. Okay? Why? Well, if you go out, in the sun and you're jogging, your body's getting hotter, and you want to cool off your body. So if you're sweating, you're putting water on the surface of your skin, and then water is going to evaporate, and the evaporation of water is what is going to cool down your skin. Okay? Now you should say, what if you are jogging in a very humid South Florida, right? You have 100% humidity of the air and you're trying to jog and you're overheating and you are sweating like crazy and still you're very, very hot. What's happening? Well, the water is not evaporating because it has nowhere to evaporate because the air is already saturated. So that is not an effective way to cool your body. You're just going to sweat like crazy. But if the sweat is not evaporating, you're still going to be hot. Okay? So in order for you to cool down, in order for this system to cool you down, the water has to evaporate. Okay? So this is your sensible type of perspiration. How much can you sweat in a sensible type? Look at this, 3 gallons of water. That is a lot of sweat. Imagine 3 gallons and you sweat in a day. You got to drink a lot of water to rehydrate, right? All right. So that's the type of sweat that is a sensible type of sweat. Okay. Now, what about the opposite? When the temperature gets really, really cold, your blood vessels are going to constrict in order for you not to lose too much body heat. Okay, so you have also temperature control by constriction of blood vessel, internal temperature control. And this is also why sometimes when you are in extreme cold temperatures, you get frostbites, right? Because your extremities do not really get a lot of blood supply, and it can actually undergo necrosis. Heard of frostbites? Kind of dangerous. So you get like ear frostbites, toes, fingers. Yeah, extremity, you know, it can be serious. All right, metabolic function of the skin. Mainly, you're going to help to produce vitamin D. So one of the stages of vitamin D production is on the skin, and then it goes to the liver, the kidney, anywhere else. But the skin has a good part on producing vitamin C. D, not C. Vitamin D is very important for immune system function. Okay, and it is a lipid soluble vitamin. You guys know your lipid soluble vitamins, right? Yes? All those, how you remember it? Naked. There's no vitamin N. Okay, so the other ones are your lipid soluble vitamins. Vitamin D is one of them. Another important function for the skin is the production of this enzyme that is called collagenase. It helps on turnover of collagen, and that helps your skin to keep this youthful appearance. Okay, so turnover of collagen, you kind of prevent formation of wrinkles. So those are metabolic functions. And here is another question. So I'm going to put here, oh, you guys, let me see here. I'm going to put here the confidence mode. But this is such an easy question. So everybody should be very confident about the answer here. Sorry, it's not letting you pick? Oh, you picked. Okay. So got 5 seconds. 3, 2, 1. Okay. Hopefully everybody answered. Open it again?
Yes, please.
Okay, those of you who already got the point, don't vote again. Okay, so I will open it again. Those of you who did not get the point, make sure you get your points now. No double dipping. I see double dipping. I'm gonna go after you. Okay, so those of you who did not answer before, what is your answer? D, vitamin D. Okay. So let me choose. What is going on? There we go. All right. So here is the other function that I mentioned, blood reservoir. So look at this, up to 5% of your total body volume can be stored on the skin. Okay? And sometimes you can have problems of storage of too much blood in the skin in case you have those allergic reactions, too much production of histamine. They can dilate your blood vessels and cause blood vessel leakage. Okay, so that can cause extreme vasodilation and shock. Okay. So problems with the skin. First problem that we're going to see is skin cancer, and another common problem here is skin burns. Okay, so let's see a few of those examples. First thing, what can cause skin cancer? Anything can cause skin cancer, especially UV radiation. Okay, so when you go out in the sun, you make sure that you have some sunblock. But if you go out in the sun and it's not too sunny, like if you take early morning or late afternoon, then you know it's not really a harmful level of UV radiation. That's actually helpful at those times, is helpful for production of vitamin D. Okay. Types of cancer that are common. You're going to have basal cell carcinoma. That's the least of the problems with cancer, skin cancer. Then you're going to have squamous cell carcinoma. And the very bad one here is melanoma. And I added another one, you'll see why. Okay, so let's see the first one here. Basal cell carcinoma. Where are you going to find the basal cell? At the bottom. What's the name of the bottom? Stratum basale, right? The basal, germinativum one. Okay, so this is the least malignant type of cancer. Okay, and oh, the answer was right there. Look at that, stratum basale. Okay, so those cells are going to proliferate, and then you see something that looks like this. Okay. It's quite common. It's not going to become malignant, and usually people don't even pay attention to it. If it gets really bad, you just cut it off and it doesn't come back. And the story. Okay. And then you have this other type of skin cancer. So this is squamous cell carcinoma. So where are you going to find your squamous layer? Well, not in the stratum basale. Those are stratum up above stratum basale, right? You have spinosum, you have granulosum. So these are the cells that are still alive, and they start to divide uncontrollably, right? And this is how you get cancers. Because if it is all the way in the stratum corneum, you're not going to get cancer cells there because those cells are dead, right? You only can get cancer from cells that are alive. Okay, so these guys, squamous cell carcinoma, okay, those guys are usually not a problem. Okay, you get uncontrolled growth of keratinocytes of the stratum spinosum. Okay, and they tend to grow in certain areas, like on the scalp, across to the ears, on the lower lips of hands. Okay, so those are usually where you see this type of lesions of cancers. Okay, usually what you do, you go to a dermatologist, and the dermatologist will extract it. It will just, excise it out, cut it out, and usually you don't have a problem. And they tend not to metastasize, so not a big deal. Okay. And then you have this other type here. This is the type that I did not have before. I just added today. Okay. This is sebaceous carcinoma. It's quite rare, but it is quite aggressive. Okay, it's not very common to find sebaceous. What are the cells here that are involved in this type of cancer? Sebaceous glands, cells in the sebaceous glands. Okay, the same ones that are causing trouble with pimples. Okay, it can become sebaceous carcinoma. Okay. How are you going to identify it? It looks like a little wart, but not quite. You can get confused between this and the wart. Okay, sometimes it bleeds, sometimes you don't feel anything. Sometimes it seems like it is a little wound that will not go away. So this wound is not healing and keeps on coming back. You can find it close to the mouth or close to the eyes. Sometimes like right on the eyelid, it looks like a sty, but it's not painful. That's the difference between this carcinoma and the sty. You know that if you ever had a sty, that thing bothers you like crazy. It's like you don't see the time to get the thing out, right? But this one is not painful, right? And why did I put this here? Well, because yesterday I got the communication from my vet, from my little Lola's vet, saying that this little lesion that I thought it was verruga. I thought it was what do you call it? What do you call a verruga in English? Anybody speaks Portuguese? Wart. Wart. I thought it was a wart. So warts are very common. They are caused usually by papillomavirus. You get the wart grows, the wart disappears, it solves on itself, on its own, and is not an issue. Okay. But now what happened here? When I was stuck in Brazil, little Lola here had this little wart that wasn't going away. And I did not like how quickly the wart was growing. Okay, so I thought, well, CDC and FDA, they are giving me so much trouble to come back to the US. If they see this wart, you're going to give me more trouble. So I took my doggy to the vet, and I had, the vet did the excision and extracted this little wart. And just in case, she sent it over for biopsy. And it came back positive for sebaceous carcinoma, which happens to be common in Cocker Spaniels. So here's little Royal in the plane with her little bear, okay, happily flying back home, okay. And it's like, well, I would never think about that. I thought it was a wart, and ended up to be cancer. It scared the crap out of me. I love my little doggy. Okay, and she's the most adorable thing. I mean, and her and the bear is just too much. Okay, yeah, she carries the bear everywhere. Yeah, she's okay. She's fine. She's back to her old self and mischieving and everything. And I mean, you had to see. Oh my God, this doggy carrying the bear at the airport, and everybody's looking at her and taking pictures and making videos and going, oh, it was so cute. And then she's using the bear for a pillow in the plane. And all the flight attendants were going crazy. Oh my God, she has a bear. So, yeah, she has a bear. Anyways, it's very common with dogs, especially with Cocker Spaniels. So if you have a doggy, or if you have a cat, or if you like dogs and cats, watch out for this type of knot warts. Okay. And here is a bad one, melanoma. Okay, that's bad. When you see melanoma, you take care of it right away, okay? And there are some ways here that you are going to identify a melanoma, okay? Those are they're caused by malignancies of melanocytes. Those guys are producing the melanin, the octopus-looking cell, okay? Melanocytes. So this is the most dangerous type of cancer. It is highly metastatic. And on top of it, it does not respond to chemotherapy. If you get a melanoma in a bad place, that's not good news, okay? Usually, if you get it and the patient is older, like over 50s or 60s, and the melanoma is on the arm or the legs, you can treat it. You can just, cut a beef out of the leg or the arm, and the person is fine, and the melanoma does. If you catch early enough, the person will survive. If the person is younger and the melanoma happens to be like on the torso, on the body, that's bad news. Okay, I actually had a friend, she was 26, she had a melanoma right on her belly, and she was pregnant. She did not even want to try chemotherapy. Baby was born fine, cutest little girl ever. She died 6 months later. Yeah, sad. So, that story with melanoma. How do you identify melanoma? You look at this thing, and this one kind of looks symmetric, but usually melanoma is not symmetric. It doesn't have regular borders, and it has weird colors. So you got to look at it and say, is it round? No. Does it have weird colors? Yeah, that's a bad sign. So you go and check it out. Okay, so we have more pictures here. So here, how do you distinguish a mole from a melanoma? So you look at a mole, and you're going to see here is round. It has defined edges. It is one color all across, okay? And it's usually small, like less than a 1/4 inch. It's small. Look at the melanoma. It is all weird shape. It doesn't have defined borders. Okay, you think it's here or it might be there. So weird shape, not defined borders. Usually you have different colors across this mole. Compare with that one, it's like, oh, this is darker, this is lighter. It's kind of strange. And is usually bigger than a 1/4 inch. So get the ruler, measure the mole. If it's bigger than a 1/4 inch and it's looking weird, you have to go check it out. Okay? All right. So little thing about burns. What can cause burns? Basically anything that can irritate the skin, right? Heat, electricity, radiation, chemicals, exposure to some kind of proteins, or maturation of some proteins. You can acids or bases, anything basically can cause a burn. What are major concerns about burn is that you can undergo dehydration. Depending on the extent of the burn, dehydration can happen quite quickly, okay? And you also have a problem of infections, okay? So skin infection and dehydration. Dehydration can be so severe that sometimes you have renal failure because of burns, because dehydrated so much that there is not enough blood for your kidneys to work. Okay, so it can be quite serious. So degrees of burn, you have first degree burn that is usually like you don't worry about it. Like usually you have only the very superficial epidermal layer that is burned. And you can see a first degree burn like if you go out to the beach or you're out in the pool in a sunny day, and then your back starts itching at night and you kind of feel uncomfortable. So that's a first degree burn. You don't really worry much about it. Put some aloe, allow the skin to recover. Don't do it too often because then you can have some kind of skin problem that can come with it, right? So, okay, you survive first degree without a problem. You usually have some redness, some swelling, some itching or some pain, but nothing that is extreme. All right. Then you have second degree burns. That's when you get blisters. Okay, that's painful. By the way, you can get second degree burns by standing out in the sun. You go, especially here in South Florida, the sun is so hot. You go there and you do not put sun protection, you can get second degree burn. Okay. I got another little story. Okay. My cousins, yeah, we went to the beach. Okay, so she wanted to roast in the sun. Yeah, I stayed 2 hours. I was back in Brazil. It was too hot for me. I went back home, and she stayed, and she fell asleep. And this is like 35 years ago. There was no sunblock. Okay. And then she woke up and she went home and she got blisters, second degree burns all over. And this is Brazil. Everybody's in tiny bikinis out there, okay? Yeah, she got blisters, big time, second degree burns. Okay, that was painful. Painful to watch. Okay, so careful out there in the sun. Okay, third degree burn, those are really bad. Okay, it goes deeper. Sometimes it goes like all the way to your bone. Sometimes they call those fourth degree burns. I didn't even know they existed. But yeah, third degree burns are really, really bad. You burn the full thickness of the skin. Sometimes the skin will appear grayish or very much dead, right? This is necrosis type of tissue, necrotic tissue, okay? And a lot of times this third degree burn is not painful because you already burned all the nerve endings, so you don't even feel the pain. That's sad, okay? So imagine how much a second degree burn hurts. Imagine the recovery from a third degree burn, not pretty. And yeah, very, very painful afterwards, okay? When third degree burn happens, usually you're gonna have to do some skin grafting, okay? So this is a type of autologous transplant. You get the skin from one part, you shave like a whole piece of the skin, like usually from the leg, and you cover the part that is burned. And of course, the part that is third degree is not really hurting, but your leg is gonna hurt like hell because you just took a slice of beef out of the leg. Ugh. Okay, I don't like skin things. All right, any questions about that? Yeah? Peripheral nerves can heal. Depends on the extent of the damage. So if you have proper care and fast type of care, you can have sensation growing back. So it really depends. Yeah. Yeah, the question was about healing the nerves after a third degree burn. But sometimes like the whole tissue gets so damaged, there is nothing much to save. Yeah, understand? Okay, so everybody's cool? We finished that, so let's get into the bones. Okay, so going deeper, and the way the book has it, like it jumped over the muscles, right? From skin to bones. Right? So go into the bones. All right, so what you're gonna know out of this chapter? Functions of the bones. These anatomical weird terms that are going with the bones, okay? You gotta know the two different types of bones. the spongy bone and then your compact bone. You got to know the type of cells that go in the bones, as well as with the cartilage. The cartilage gets together here close to the bones. Bone formation, part of cartilage thing. Okay. What other functions the bone has on nutrients and hormones, type of storage and production. And one thing that is not showing here is blood cell formation. Okay, well, you're going to form, you have your erythropoietic blood cells that are going to be in the bone marrow, so blood cell formation is also a function of bones. Okay, so here the chapter starts with the cartilages. As we mentioned before, you're going to have 3 types of cartilages, right? One thing that you should absolutely know about the cartilage is that you do not have blood vessels in the cartilage, and you also don't have nerves in the cartilage tissue, okay? But what the cartilage has all around it is this membrane that is called perichondrium. So when you see chondrium, something that is always relating to cartilage. Perichondrium is going around the cartilage. So that's the name of the dense membrane that covers the cartilage. It says here like a girdle, so it goes all over covering the cartilage. Okay. What is the use of the membrane? Well, basically it's going to keep the cartilage in place, because remember cartilage has this gelatinous type of matrix. So if you squish it, the cartilage can just like bulge in one side. So this membrane is going to keep it in place, okay? And also the membrane has the blood vessels and is connective tissue, right? Dense connective tissue, okay? And this membrane is going to bring the nutrients to the cartilage. Okay, so it has the blood vessels and it has some nerves also in this perichondrium that is going to serve the cartilage. Okay. When you look at the cells in the cartilage, you're going to find these established cells. So those are your chondrocytes. They're going to sit inside the cartilage in little lakes. So you call the little lakes lacuna. Okay. So chondrocytes are the sitting cells. And the cells that become chondrocytes are the chondroblasts. Those are the baby cells. All right. So absolutely, little review here on the 3 types of cartilage. Your hyaline cartilage, elastic, and fibrocartilage. We went through this before. Okay. Now, how is it that cartilage grows? And cartilage keeps on growing, like usually throughout life. Sometimes the cartilage becomes solidified or calcified, so it doesn't really grow, but some types of cartilage will keep on growing, okay? Especially the type of cartilage that you wish would not really grow as you get older, like on your nose. Yeah, oh well. How is it the cartilage grows? There are 2 ways the cartilage can grow. One way is called appositional. The other way is called interstitial. So starting here with the appositional, it starts to grow close to the membrane that is surrounding the cartilage. So the membrane has the cells that are going to secrete the matrix and is going to make the cartilage grow from the membrane, from the inside of the membrane, like going outwards. Okay, so this is type of appositional growth from the membrane, from close to the perichondrium. Okay. When you talk about interstitial growth, this is when you look at those little chondrocytes sitting in the laguna, okay? And inside the laguna, these chondrocytes are making the cartilage grow. So this is coming from inside of the cartilage. So that is what you call interstitial, inside the tissue, okay? From within the tissue. Okay. And then sometimes the cartilage can calcify, but that doesn't mean it becomes bone. It just means that it's calcified cartilage, hard cartilage. Another question. Okay. Growth of cartilage from within. What's the name of that? 5 seconds. Okay, what is your answer? A. That's your interstitial growth. Okay. Okay, so here we go 6.2 for functions of the bones. They also should be quite obvious, right? So you have a support, protection, movement, mineral storage, like we mentioned before. Oh, here it is, blood cell formation, important function of the bone. And this one is like kind of strange to think about. Storage of fat. Bone marrow, yellow bone marrow, that's fat. But you know, usually people store fat in lots of other places. You don't really need the fat inside the bone. Okay. And hormone production, that's another function that we also don't think about. Bone function. Look at this. There is this cool hormone that is called osteocalcin. And it has a function that we wouldn't quite think they would be a function of a bone. Look at this. Regulate insulin secretion. How can that be? So if you don't have healthy bones, you're also not going to have a very good control of insulin secretion and glucose levels in your blood. That's strange, right? But yeah, also function of the bone, right? So these functions here that we have not quite seen before usually, okay, hormone production, storage of fat, okay, blood formation, yeah, that's pretty obvious with the bone marrow. Okay. All right, the skeleton is made up of 2 parts. You have the center skeleton, we call that the axial skeleton. And then you have the extremities skeleton, that is your appendicular for appendages, okay? Appendicular skeleton. Central skeleton or axial, you're going to have your skull, your vertebral column, and your rib cage. That is your axial skeleton. Everything else is your appendicular skeleton. So here again, picture of your axial, should have back, and in other color is your appendicular. So here you can read that on your own. I just mentioned it. Okay, so types of bone based on shape. Okay, so you gotta know those bones, types of bones. Do you have to know all the 206 bones in the body? Hells no. I don't know them, you don't have to know them. Okay, but you have to know the absolutely necessary. Okay, you have to know your long bones. Okay, they are longer than they are wide, including bones in your fingers. You say, oh, so these are short. No, is it longer than they are wide? So those are called long bones. Okay, you gotta identify them. You gotta know the short bones. So those are kind of cube looking. So those are basically on wrists and ankles, okay? Cube looking ones. Then you have those here, sesamoid bone is also a type of a short bone, but that one is a kind of weird bone. You're not born with it. It grows on you inside certain tissues like tendons after you start walking, for example. So you have your patella on your knee that is not connected to the other bones. Actually, everybody has played around with the patella. You move around, it's like, oh, it's not connected to another bone, right? That bone was not with you when you were born. Now, next time you see a young baby that has not started walking yet or crawling, you check out the patella. There's no patella. It's weird. No patella on the baby, okay? So there's no knee really. It's just a very fat leg usually. Sometimes skinny leg look like chicken legs, right? But no. No patella, because the patella comes out later. After you start using your legs, that's when you develop the sesamoid bone of the patella. Okay. Okay, then you have your flat bones. This is like huge variety of flat bones. Look at this. You have your sternum, scapula, okay, ribs, all different looking bones. Even your skull bones are all flat bones. It's like, oh, but that's curved, but it's called flat, okay? And then you have very weird bones. Those are irregular bones. You gotta know where they are too. Complicated shapes. Mainly you're gonna look at the vertebra and identify what each part of the vertebra looks like. Okay, so those are irregular bones. So examples here of each type of bone. Okay, as I mentioned, flat bone here for the sternum in front of your heart. Then you have your long bones and short bone, and here irregular type of bone. Okay. And another question, got a lot of points for you today. The terms long, short, flat, and irregular are used to classify bone based on what? Hey, everybody should get it correct. Okay, 3, 2, 1. What is your answer? C, shape. Okay. All right. So structure of the bones. This is the time that gets a bit tricky. Okay, there are certain things you absolutely have to know about the structure. Okay, bones are organs. Okay, so you have several tissues that are involved with the bone. You have nervous tissue, you got cartilage, you got a lot of connective tissue, you got muscles that are attached to the bones. Okay, you have endothelial cells. Here it says epithelial, but it's really endothelial cells in the blood vessels that are getting into the bone. Bones are very much vascularized. When you break a bone, there is a lot of bleeding in the bone. Sometimes you don't see the bleeding because you have a membrane around the bone, and the bleeding is like concentrated inside of the bone. But you do have a lot of bleeding if you break a bone. And there's a lot of nerves that go through the bone. I mean, if you ever broke a bone, does it hurt? A lot. It's like very, very painful. So you have a lot of nerves going through the bones. Levels of structures in the bone. What you see, that's your gross anatomy. And when you look in the microscope, you're going to see the microscopic anatomy, and then you're going to see some chemical structure of the bone. When you say chemical, that is a telltale sign that says if you see hydroxyapatite, you think bone. That's the only tissue that will have hydroxyapatite. Okay? All right. So here, starting here with the two different types of bones. So you have compact bone and you have a spongy bone. You look over here and you see this dense thing that you cannot really see what's inside. That's your compact bone. And you see inside and it looks like a sponge. That's your spongy bone. But don't be fooled, the spongy bone is not soft. It's very hard bone, but it just has a lot of holes. Okay? What do you call the holes? Trabecula. Okay? Trabecula is the fancy name for the holes, spongy holes. Okay? Now, when you look here at this long bone, you'll see that it has a bone marrow. It has a hole in the center. Okay, it has a cavity. But when you look here in the spongy bone and you see this trabecula, you see the trabecula is filled up also with bone marrow. Okay, so the bone marrow is all inside these little holes. Okay. All right. So here, when you look here at your short or irregular or flat bones, they all come with more or less the same kind of anatomy. Okay, you're gonna see two slices of hard bone. Okay, and inside you're gonna see the spongy bone. So you have a sandwich of spongy bone. Okay, so this is happening with all these bone types. Okay. When you look at the bone, what you're gonna see? First thing you're gonna see, there is a membrane all around the outside of the bone. So you call that membrane periosteum. Now keep in mind the periosteum is made up of two membranes. There is an outer membrane and then an inner outer membrane. Okay, so two membranes for the periosteum. And then when you look at the inside of the bone, in this case here, since you have a flat bone, when you look at the inside of the bone, you're going to find your spongy bone covering every little hole of this spongy bone. You're going to have this membrane that is called the endosteum. Okay, so here you're going to have endosteum covering every surface here of those trabecula. Endosteum inside, only one membrane on the inside, two membranes on the outside. This is the outside, this is the outside, this is the inside. Okay, since you're looking at a flat bone over here, so there are two outside of the flat bone. Okay. When you look at the bone marrow is scattered through this trabecula, okay? And depending on which bone you're looking at, you also find that at joints you have hyaline cartilage that is covering the bone, so you don't have like bone and bone hitting each other. You have this covering of cushion material that is usually hyaline cartilage. Okay. So here looking at a long bone, okay, you're going to have two main parts. You're going to have the tips, so you have proximal and distal epiphysis, that's the top and the bottom of the bone. In the middle, you call this long thing the diaphysis. Okay, so epiphysis and diaphysis. Now, when you look at the long bone between the diaphysis and the epiphysis, you're going to find here, if you're looking at an adult bone, you're going to find here a part that is all looking like hard bone and is kind of solidified. This is the part that used to be cartilage. Okay, so if you look at a growing person, you still see cartilage over here because the cartilage is going to grow. Cartilage can grow. Okay, it's going to allow growth of the bone. Now, when it solidifies, then you don't have growth of the long bone anymore longitudinally. Okay, so the epiphyseal line is the solidified cartilage that was between these two areas of the long bone. If you look at here and you see cartilage, you say, okay, it's a child or it's a teenager, it's a growing person. Okay, if it is a child, this is going to be wider of cartilage, and if it is a person that is almost done growing, you're going to have a very thin line of cartilage in there. When it's growing, you call that epiphyseal plate. So here, the tube is the diaphysis, the ends are epiphysis. Okay, now the cavity in the center is filled up with bone marrow, also has blood vessels. Okay. And at the tips, you're going to find cartilages for articulation. Okay, so here is starting to look at the microscopic structure of the bone. When you see here a compact bone, remember, this actually is showing the cartilage close to a joint. Okay, so we're going to see the next picture, the membranes that are on the outside. So when you have cartilage, you're not going to have the periosteum. Then you have cartilage right there. Okay, so here you have a cartilage by a joint. And now when you look at a compact bone, you're going to have these structures that are those little straws, and that's your osteum. Okay, so let's see here. This is the compact bone, and then on the inside you're going to have this spongy bone, and here is missing the rest of the long bone structure. What you're going to see here, you're going to see blood vessels going everywhere. Okay, so here's a picture for the periosteum. So the outside, you have two layers of this membrane. You have the outer layer that is very, very tough. Okay, you have dense, irregular connective tissue because you want to really support the bone from all angles. So dense, irregular. When you look at the inside layer, this is what you call your osteogenic layer. Osteogenic because it's going to have cells that are going to nourish, they can become osteoblasts and osteocytes because they can differentiate and become bone cells. Okay, so you have your stem cells at this inner layer of the periosteum. So the inner layer is called osteogenic layer. It has osteogenic stem cells that are sitting there. Okay. The periosteum, we're going to look and you're going to see sometimes you have little holes. So the holes, you don't call them holes, you call them foramen. These holes are useful because they are passageway for blood vessels and nerves to go inside of the bone. Okay. All right, so when you look at the inside of the bone, this one you're going to have that layer, the membrane, one layer of membrane here. That's your endosteum. And that is going to cover all the surface of those spongy bones. And also when you look here at your compact bone, inside the canals, you're going to also have periosteum covering inside of the canals. Okay, so another observation here is that in this one layer of the endosteum, you're also going to find stem cells that can differentiate to fill up whatever the bone needs at a time. When you look at the bone marrow, so in young kids, in your long bones, you're also going to have red bone marrow. Now, when you look in adults, you're going to have red bone marrows mainly in the flat bones. So skull and hips, that's where you're going to find red bone marrow. Now, in adults, when you look in the long bones, like in your femur and the humerus, you're going to find the yellow marrow. And that's mainly fat. So your red marrow, from the time you were a kid, it kind of transformed into fat as you grow older. Red marrow is very, very important for production of blood cells. Okay, all blood cells are going to come from the bone marrow. So your white blood cells, your red blood cells, they all platelets, which are not cells, they're all coming from the bone marrow, from the red bone marrow. Sometimes in adults you can have yellow bone marrow that differentiates into red bone marrow. But that is only in case of certain diseases, in particular in case of severe anemia, in which your blood really has to produce more blood cells, then some of your yellow bone marrow can become red bone marrow again, like temporarily. So you recover from the disease and then it becomes a yellow bone marrow again. Okay, so red bone marrow is what is going to produce your blood cells, all the blood cells. Okay. Types of bone markings. This is when you're going to see strange names. Okay, what you got to focus on the last 2 minutes here. Projections, depressions, and openings or holes or indentations. So I put here, and this last 2 slides, the terms that you should know. So crest is like a curve over there, like bulging out. Okay. Spine is a little thing that is protruding out of a bone. Process, that is anything that sticks out of a bone, is a process. Okay. What else we should know here? Head of the bone. You have something that is attached by something that is narrower, like a little neck. So you have head of the bone. And then you have facets for articulation. Foramen, those are holes. And fissure, those are little cracks. So I think that's pretty much it. Oh yeah, sinuses. Those are empty holes on the bone. Okay, sinuses are like usually with air. So empty holes in the bones are sinuses. Okay. Oh, groove indentation. So whatever is emphasized here, those are the terms you should know. Should you go crazy with condyle, groove, meatus? No. Just emphasize on those that I marked.